Everybody for coming. First, we have the approval of the minutes of July 27th, 2021. Can I have a motion, please? Sharon, are you? Oh, okay. We need to have a motion for, I'm going to change the motion. This is going to be a motion to vote to let Betty in on teleconference, so. Miss Eden Blair and Linda back there, thank you. All right, all those in favor say aye.
Aye.
Opposed? Motion carried unanimously. You're in, Betty. Okay, thank you. Now we'll entertain a motion for the approval of minutes of July 27th, 2021. Sharon? Jennifer, or Rachel. I was looking at Jennifer. Excuse me about that. Sorry, Rachel. Okay. Any discussion, comments, approval? Jan does a great job, so I think we'll look for the vote then. All those in favor?
Aye.
Opposed?
Aye.
Motion carried. Thank you. Okay, monthly financial report.
I was reading that as on. Okay.
Yep. now we
Good
can hear you.
afternoon. We are now in June, so we are halfway through the fiscal year. That's exciting. So we now have property tax distributions that are hitting our financials. So including the property tax distributions and the general fund alone, we're about 4.3 million, or about 21% higher than 2020, which is to be expected since we saw a tank last year with revenues because of the pandemic. So everything, all the categories and revenues are trending at or above expectations. The only three categories are not is property tax distributions, which that is cyclical, so that's to be expected. Investment income is just a hair under what we should be at, and then transfers, which will be received by the end of the fiscal year with how we book everything in period 13. There's only three categories to call out as far as major revenues. We continue to see sales tax favorable. So through June, we're about $1.3 million higher than budget expectations. So right now we're about 49.3% of where we should be with the budget compared to, or we're at 49.3% of budget compared to what would be normal, about 39%. So that is doing good. And that all is due to the Illinois Level Playing Field Act. So higher income tax, or Illinois, higher receipts based off of online sales. Income tax is trending about 35% higher. So an important note, and I believe I brought this up last month, but now 4 out of the last 6 months of the income tax receipts, so the first 6 months of 2021, 4 of those months are the highest income tax receipts we've received of the 24 years we've been tracking them, which is incredible. That is due to 2 main reasons. The one is the weekly supplements of unemployment benefits, which are taxable in Illinois. Those, as some of you may know, are going to expire in September. And the other is because we're now at 100% of the LGDF distribution to local government, which prior to this past year, it was only at 95%. So those 2 main factors are a big reason why income tax is doing really well. Even with the unemployment benefits going away, for those of the board members that have been in the meetings, our county compared to everybody else, we're seeing a lot of job openings and competitive rates. So we believe that even with the unemployment benefits going away, hopefully they'll be offset and people actually returning to work, higher wages, and income tax receipts. The last thing to call out is the personal property replacement tax. We did receive the August, and we're still about 85% or $2.5 million higher than we expected. So that is really main to do with certain sectors that are doing really well, such as technology and banking, insurance, housing, communications, and similar industries, which have seen significant rises. And that has greatly offset the losses by the airline and the travel and the hospitality and small business markets. So with the opening of the economy, plus the federal stimulus policies, which are hitting, if you have families, you get the child tax credit monthly, so that's helping. Plus the low interest rate, consumer spending will remain probably good the rest of the year. And we will continue to see good corporate. One other factor that is in here for personal property tax repayments are 3 laws that have been passed by the General Assembly. And more details about that is in the report, which impacts. And then lastly, for the fund balances, because we now have the property taxes, County Highway, IMRF, and FICA are now within policy limits. And the other funds all have a reasoning and should be, they have a plan according to policy. So if you guys have any questions, I am here.
Oh, there were a lot of positive in that report. Thank you. Any questions of Julie?
And as Randy's time is coming to a close, I may have him do this 1 or 2 times to have him enjoy the fun before he heads back to the sheriff's office. Yeah. Well, that would be an upper delegation, but anyway, thank you all. Any questions?
Doesn't
No?
appear
Okay.
there's any. Thank you. Appreciate it. Okay, we'll have the Headington Oaks report. Shauna, please.
Good afternoon, everybody. Paul is out this afternoon, so if there's any questions on the Huntington Oaks monthly report, I can definitely try to answer those. And then, do you want me to go ahead with the financial plan?
Yes, go ahead.
I'll have a little bit of a more general overview for you on the financial plan regarding the accounts receivable specifically. So the financial plan is the colored sheet in your packet. Quarter 2 has been updated to reflect all of attempted collections through the end of quarter 2. We have filed the Medicaid cost report as well as the Medicare cost report. Later, at a later committee, hopefully the September committee, we will be bringing forward to you a resolution that shows the amounts that we can receive as a 66% reimbursement from Medicare. We need to have those approved by the board, and then we will file an amendment with Medicare so that we can get those items reimbursed. And so if you go down to where it says goal at the bottom of the quarter 2 column, we were going to, by the end of quarter 2, have attempted collection on 30 to 40% of the total AR, so touching all those different accounts. We did meet that goal. As of right now, we have, in actual cash receipts coming in, we had 3%. 7% of those are tied up in court, working with the state's attorney's office to file against some of those vendors. So we should have an update here over the next few months in terms of a resolution for that. 23% of those cases are under review with RSM. That is basically that Medicare component that we'll be bringing back to you for specific action, hopefully here later in September. And then once that gets submitted to Medicare, then we should receive reimbursement for that, and that's a big chunk of our AR. So we're about 80% done with that process. So we should see some cash coming in from that here in the next couple months. And then after that, we have another 8% under internal review. Some of that is cases that we have been actively, or Paul has been actively working with Linda to help us get some things cleared up with Medicaid, and then also just undergoing in our own review and billing internally for a total of 41%. So of our total just over 4.3 million in outstanding AR, we have just under 2 million that we are actively pursuing at this time, and then we'll have be moving into that other next batch to be reported out under quarter 3. So I'm happy to answer any questions you might have about that.
Thank you, Shauna. Any questions of Shauna on the report? No? In government, it takes time to clear all this stuff up, that's for sure. So thank you for your hard work. Okay, legislative update.
Nothing to report this month, Mr. Chairman.
Thank you. Okay, the American Rescue Plan Act update. Scott, you got that?
Yep. Thanks, Mr. Chairman. So there's some materials in your packet. I've also, so that'll be up on the screen. since we distributed packets on Friday, I added 2 slides that you saw from the policy session back in May or June when we went through a pretty detailed dive of the act. And those are these first 2 slides. So just to remind everyone of what the federal law says the objectives of the funding are. There's 4 of them. One is to support urgent COVID-19 response efforts. Second is to replace lost public sector revenue. Third is to support immediate economic stabilization. And the fourth is to address systemic public health and economic challenges. Additionally, to remind everyone of what the ineligible uses are. So this is a slide you've seen before, although it was a couple months ago. We cannot use these dollars to reduce net tax revenue, i.e. give a tax break. We cannot make a pension payment, not a problem for us since our portion of IMRF is fully funded based on what IMRF tells us to levy on an annual basis, and then you turn around and do. We cannot use these dollars to build up our financial reserves or our rainy day funds. And lastly, we cannot use these dollars to make debt service payments, pay off lawsuits or judgments against the county. So some updated information related to the interim guidance from the Treasury. Our first report to them is due at the end of the month. That's early next week. I believe it's actually a week from today, if memory serves correctly. And then that report needs to have a general plan of how we're going to use our allocation that can be amended throughout the life of the grant or allocation. And we can also, at this time, we are not required to articulate in what years we're actually going to spend those dollars. So really what we need to do is just provide in the report of how much money we're going to spend on each one of the buckets that was in the act. And then any results of citizen feedback that we might have. There is a population threshold in the act, and we are below that threshold, so our reporting requirements are much less than larger jurisdictions, where they have to actually go through a much more detailed reporting process. Those larger jurisdictions have to have a much more detailed plan how they're going to spend those dollars in much more detail and over in how much in each year over the life of the funding as well. So looking at our citizen feedback, we had a little over 350 folks take or at least look at the survey. We asked 3 basic questions. The first one is, are you at least 18 and live in Peoria County? The second one is shown here, and that is please rank the spending priorities, with 1 being the most important. Of the 350 or so respondents, only 293 actually responded to this question. And in rank order, and granted, we did not do any education about how we can use money within each of these buckets. But the most important one for the residents that responded was to invest in water, sewer, and broadband infrastructure. Probably a fair statement to make that they may or may not know that the County of Peoria is not in the water or sewer utility business. So those are things we don't do. But again, not having the opportunity did not take the opportunity to go through an exhaustive education process as part of this survey. Number 2 was providing premium pay for essential workers. 3, addressing the negative economic impacts of the virus. 4th is supporting public health expenditures, and last was replacing lost public sector revenue. Yeah. Yep.
One a score of 1 was the highest priority. So did you then reverse score this so that 3.18 was the highest, or?
Yeah, so based on how Gretchen extracted all the information, and so yes, this is the final rank order of most important to least important here. We did ask a third and final question, and that was, what's the most important issue facing Peoria County government as it relates to COVID? There were 293 responses to that. I have not had as much time as I would have liked. We just closed the survey late last week to do a full analysis of really what was, if that open-ended question is consistent with the results that you see in the bar chart up on the screen, or if there's deviation in terms of what the open-ended question might say. So that some more information to come on that. Just didn't have the time before the survey closed in this committee meeting today to look at that detail. All right. So to remind everyone of what the 6 buckets are that you can use these dollars on. One is to support the public health response. Second is to address the negative economic impacts. Third is replace public sector revenue loss. Fourth is premium pay for essential workers. Fifth is water and sewer infrastructure. And last is broadband infrastructure. This last slide here is what I verbally reported out to the committee last month. And so Mr. Fennell just merely asked me to put that into writing so that you would have it in front of you. So you can see that in the first category, we make reference to both supporting the public health response and addressing negative economic impacts through 2 methods. The first is $2,403,000 and change. That number represents the portion of our allocation that does not meet the definition of lost revenue. What my recommendation there is we would actually look to the city to cost share at an equal amount, creating a pool of $4.8 million in change that would go towards the social determinants of public health. We would use those dollars in an equity-based fund that would have funding tied to it for evidence-based practices and solutions. That way, it's outcome-based and it's data-driven, as opposed to merely giving money to the frequent participants and stakeholders in the community. They still may get those dollars, but it's going to be on an evidence-based basis versus just as a handout. And in all the cases, as I'll walk through each one of these, there literally is not much more detail to this at this point than what I'm going to articulate today. Second is $1 million for small business assistance. We've got flexibility to create some programs there. And again, we would look to, we have, if you remember from the adoption of your rules in December, we actually have an advisory committee on small business development and entrepreneurship that's chaired by Ms. Blair, whose membership is ideally going to be appointed here at the next county board meeting.
Brandy Bryant joined.
And we would look to work with that advisory committee, which reports to this committee, in terms of how we might structure any small business assistance program that you would create. You'll see in the middle the icon for replacing public sector revenue loss. And really, it's $28.9 billion of capital improvements. I do specifically call out for this committee's discussion, and we're not required to do so for our report, but just for the body here today, 14 million of that would be dedicated to the Health and Human Services campus. For those of you that are not on Sharon's committee, they forwarded 2 resolutions to the board today. One is the award of the most qualified architect for architect and engineering services of Farnsworth Group, and a recommendation for the construction manager at Risk Services, which is recommended to be River City Construction of East Peoria. The remaining $14.9 that you there see in capital, it would be my recommendation that Mr. Salzer's committee work through the prioritization of that and how you would allocate those dollars on a project basis and also over time. Remember, we have until December 31 of 24 to determine how the dollars are going to be spent. And then we have until December 31 of 26 to actually spend every last dime. Next is broadband infrastructure. I'd recommend $2.5 million in broadband related projects. And here, what we're wanting to do is, as I've said, I think at a couple different meetings in the past, and I'll repeat again today, it's not my recommendation that we get into the pipes and wire business, i.e., if fiber is to be laid or microwave is to be put on towers, we shouldn't be the ones to own that infrastructure. A better example is the efforts of rural electrification, whether it be in this area here or the massive work that the Tennessee Valley Authority did as part of in mid-last century, whereas we would be using our dollars to leverage on a competitive basis. I believe there's 6 or 7 billion with a B dollars for broadband in the infrastructure bill that was approved by the Senate a couple weeks ago and is in the House now. We would use these dollars to leverage some of that $7 billion here locally, so that we could then partner with the private sector who is in the business of owning, maintaining that infrastructure, and then trying to capture subscriptions from individuals within their service areas. There are franchise agreements that they would then use these dollars to put that infrastructure either above the ground on a tower or in the ground in the way of fiber. First part of that, though, is we'll need to do some type of study similar to what Tazewell County is doing to determine geographically where the need is greatest in the county. You'll see that there is no recommendation for water and sewer infrastructure. We do have a request from the village of Princeville and the Edelstein Water District to grant to them some dollars for a water project. The Edelstein Water District is in northern Peoria County. It's in Mr. Elsasser's district. They have a single well that's almost 1,900 feet deep. They have radium present, which is common at wells of that depth. They don't have a second well, and it's cost prohibitive for them to really build a second well or make improvements to the water treatment plant. What they would much prefer to do is partner with the village of Princeville and extend a water main from Princeville to their water district and their customers within their water district. I bring that to you in terms of disclosure. Mr. Elsasser encouraged them to make that request. It's my recommendation that we have enough other needs within our own organization that we should use those first. Additionally, if we were to grant their request, there would be a whole line of similar requests behind them. And when do you stop saying yes and start saying no? And somebody is going to, unfortunately, be unhappy about that. And then lastly, you'll see premium pay is to be determined. Mr. Renault, who can't be here today, has asked staff to evaluate what some premium pay might look like. HR is still working on that, and I know we owe him that response. But at this point in time, I'm not prepared to make a recommendation either way on premium pay in terms of using any of the allocation. And if you wanted to put some money towards premium pay, then you would need to decrease one of the other numbers that's above it there on the slide. Mr. Chairman, happy to answer any questions. There's no agenda item for a vote today, so merely a consensus of the committee is really all we're looking for, so that we can file that first report at the end of the month, which is next week. And obviously, we can always go back and amend that as the county board and this committee continue their discussions.
Okay, thank you, Mr. Sorrell. Is there any comments, questions? Yes, Kate?
Just if you can go a little bit further, one of my questions is, because that report is due August 31st, if we want to move things around, how flexible is our ability to do that in the future?
We have to make a report once a quarter, every quarter through the end of 26, probably first quarter into 27, which would be the final report. So there is great flexibility for us to move things around, because at some point we'll actually have to also report out how we're actually using those dollars too.
Good question. Anyone else? Mr. Rosenbaum?
Just a question on the premium pay, to bring me up to speed on that maybe a little bit more. What essential workers how would you determine who would get premium pay and who wouldn't? Because it's all in the eye of the beholder who's a essential worker.
Great question, Mr. Rosenbaum. Mr. Renaud put out a definition for us so we could do that analysis for him. Going into any more detail, it is, I would say it's multiple subsets of the organization, not the entire organization. Any more detail, I would say we really should discuss in closed session under collective bargaining, or happy to talk to you offline.
So we're talking about county employees? Or
Yes, yeah. So, and a great question, because the law actually says that you could do it for county employees, or there's some provisions where if you wanted to explore the concept of universal basic income, you could do it for residents as well. I say that there's a couple of large jurisdictions across the country that I specifically know of, and there's probably others that are taking a pilot project where a universal basic income pilot project where they're picking 100 families or 50 families, and for 12 to 18 months actually providing them a check. It could be $500, it could be $1,000, depending if it's a single parent or two parent household, to see what the economic impact of that might be. So thanks for asking that, because there really are two different provisions within that bucket.
Anyone else? Okay.
Mr. Chairman, if there aren't any more questions, or if there's,
Linda, excuse me, Linda, yes.
I'm just curious to know how you determined 2.5 million for broadband.
To be perfectly honest, that was what was left after all the other numbers had been calculated.
Okay, well, because this is something that I am really, really interested in, based on the fact that I think people who do not have internet service are really being left behind in our economy. And that certainly is not to say that we should be anything but leveraging as you're suggesting, but 2.5 million doesn't seem like very much money to me. So I would just ask that we take a look at that and see if we can really make an impact with that amount.
It would be my goal to get to try and leverage 10x of that. So to try and leverage additional 25 million for the 2.5 that would come from here, at minimum, if not more.
Okay.
through grants. That's that correct? Through other grants from
Right,
federal?
so, you know, as I said, there's $6 or $7 billion in the $1 trillion federal infrastructure bill.
Yeah, okay.
And there may be even more in the federal budget package that's multiple trillions of dollars. I haven't had a chance to look through that yet.
Good. Any other questions?
Question.
Bill, yes.
I'm looking at this premium pay, and I know you're going to give us some definitions, Scott, in regard to this. Would this also encompass like the increase in health insurance for our employees? Could we somehow use this as a relief for those people?
So, Mr. Salzer, what we would, it wouldn't, the end result is yes, but we would not specifically title it that way. The way it's structured, we would essentially give a one-time bonus of a certain dollar value to employees if that's what you wanted to do. And then they could use those dollars however they chose to do so. They could use it to put into their savings account. They could go spend it and continue to revive the economy, or they could apply it towards their health care costs. It'd be their choice.
Okay. Look around pretty closely. No other hands? Okay, thank you.
All right. So, Mr. Chairman, we'll go ahead and file the first report with these numbers as shown here, and then obviously we can continue the conversation as we get into the FY22 budget process.
Very good. Do you have any other reports that you want to mention?
I do not, Mr. Chairman.
Okay, miscellaneous. Any miscellaneous comments from anyone? No? Then we'll be adjourned. Thank you.